Take 25.
Hi, my name is Joyce Gingrich. I've been a nurse for 27 years. The last 5.5 years I've been an oncology nurse at IU Health Goshen, and it has been one of my favorite jobs. Also represented today is Anne, who delivered a baby this morning. She was not able to be with us on this interview, but really wanted us to share her story. Our story being in December of this year, we were terminated or we lost our job for not taking the flu shot. And Anne did not want to injure herself or her baby in any way by taking the flu shot, and so she also walked away from her job.
Hi, my name is Sue Schrock. I was a hospice nurse for the better part of the last 20 years, but I've been a nurse for over 40 years now. And I too lost my job. I did actually resign my position because I too refused to take the flu shot. Our goal today with this video is to give you our thoughts and ask you to do your own research. There's lots of research out there. Don't just assume that what you're getting is safe for your body or effective for your patients and that kind of thing. So we'd like you to do your own research. We'd also like you to give us feedback, but if you'd like to respond to this video if you'd like. But please, we're asking for the positive responses. If there are folks out there that would like to partner up with us and support us, and we'd like to support you, we'd like to know who you are. There's lots of you out there that have lost your jobs or have an objection to the flu shot. We'd like that camaraderie. We're ready to go ahead with the questions.
Okay, I have a few questions I'd like to ask. The first one, I'm going to start with you, Joyce.
Okay.
Healthcare officials are saying that this is a patient safety issue. How do you respond to that?
Well, I respond first by saying patient safety is a huge issue with me, and I am not advocating anything less than ultimate patient safety. And I believe the number one way of not passing germs is good hand washing and staying home when you're sick. Those two things are very valid. They've been that way on the books in the research for years, and they continue to be. Unfortunately, the hospital has now been promoting the flu vaccine as the magic bullet, and we would like to show you today that that is not actually the magic bullet. I would like to quote Dr. Tom Jefferson. He's the world's most authoritative expert on respiratory infections and vaccines, and in a study they did, he says this: influenza vaccines have a modest effect in reducing influenza symptoms and working days lost. There is no evidence that they affect complications such as pneumonia or transmission. So there you have it, folks, from an expert. There's no evidence that transmission is helped in any way by getting the flu vaccine. Also, I would like to show what OSHA says. OSHA is the Occupational Safety and Health Administration, and they issued a statement opposing mandatory flu shots for healthcare workers that do not contain exemptions for medical, religious, and philosophical belief reasons. So even though they are for patient safety as well, they're not promoting the mandatory flu shot.
Okay, thank you. Sue, the same question.
I would like to talk about the efficacy or the effectiveness of the flu vaccine. The vaccine that folks got this year contains 3 viruses, which is pretty normal. World Health Organization decides based on last year's flu what to put in this year's flu vaccine. So it contains 3. Whether they hit their mark on that, I think it's too early to tell. Some places are saying yes, it did, and some places are saying no, it didn't. The problem with that is these viruses mutate or change. So by the time you get that vaccine, it may no longer be what's really floating out there and whether you're protected or not. CDC says, and that's the Centers for Disease Control, says that it's about 60% effective. There are studies that say other things than that, but we'll go with that. That means 60 out of 100 of you who are vaccinated may have some protection, 40 of you may not. In that range somewhere. So the efficacy is not very good. What I'm promoting is 365 days a year of you taking care of yourself and building up your own immunity. And that is with proper rest, that's with proper diet, exercise, lots of water. Take your multivitamins if that's what you believe in. And in our house, we do the vitamin D3. That's the sunshine vitamin. We don't get much of that this time of year. But year-round, we take vitamin D3 to boost our own immune system. And there's lots of studies out there that talk about how much more effective that is than a flu shot. So do your research again. Do your homework. The other thing I want to talk about are hospital-acquired infections. And the CDC again has stated that 1 in 20 hospitalized patients will get a hospital-acquired infection. That means you didn't come into the hospital with it, but you got it while you were there. The numbers I've seen are 80,000 to 100,000 people that can be affected with that. Now, some of those people die. They don't come out of the hospital because they got that acquired infection. We're not hearing that. We should be hearing those kind of things, and hospitals are working on those things. I do get, that has kind of leveled off, but it's still too big. But we don't hear about those. They don't want that out there. The other thing are appropriately ordered, prescribed medications that people die from because of side effects, adverse reactions, whatnot. We're not hearing about those either. We're hearing about how tragic it is to get the flu. And yes, there are deaths from the flu. Yes, there are. But what are we seeing about that? Is it people that got pneumonia? Are they really flu? Is it flu-like illness? Is it pneumonia? Are they people that were compromised to begin with? And what they're saying is that the flu vaccine is most helpful for older children and healthy young adults. So I think we have to take those kind of things into consideration and see if it's really, really the magic bullet or not.
Okay, Sue, I'm going to start with you on the second question. Healthcare officials say the vaccine is very safe. How do you feel about this statement?
There are side effects with anything. And of course, there are side effects with this, and certainly the benefits don't outweigh, or the side effects are too heavy here, weighted too heavily here. There's aluminum in these flu vaccines so that your body can start an inflammatory reaction to get the antibodies started to fight against this. And that takes a couple of weeks to get that going. But aluminum in any amount is dangerous for your body. It certainly isn't healthy. And from what I have read, it contributes to the neurological kinds of side effects that people experience. And in the literature, right from the package insert in the influenza vaccine, it talks about a disease called Guillain-Barré, or a syndrome or whatever. Starts with paralysis of your feet and kind of works its way up. If it gets into your lungs or as far up as this area, you're going to be on a ventilator. You may or may not come off of that ventilator, and you may or may not die. And you may or may not have long-term effects from that Guillain-Barré. So there's all kinds of side effects.
Okay, Joyce, how about you feel about the same question?
To piggyback along with that, another side effect of the flu shot is cancer. There's a study that links lymphoma to the flu shot that would actually increases your risk of follicular lymphoma by 98%. I have a family history of cancer. It would be not a wise decision for me to put a flu shot in knowing there's carcinogenics in there that could cause cancer in my own body. I know some friends who lost a friend to lymphoma after they got the flu shot. That person just passed away this past summer. Sue has a friend who died from Guillain-Barré just in December of this year. So we both know people just in our small circles that have had side effects from the flu shot that they say is a very small percentage of side effects. However, we know people. So this is a very real thing, folks, to experience side effects. Our hospital had us as employees sign a waiver, and I have this waiver right here, absolving them of any responsibility from adverse effects from the flu shot. So they know that there's possibility of side effects. Why would they have us sign this if they didn't?
Very true. Okay, Joyce, the third question. What are your personal beliefs about the flu vaccine?
My personal beliefs about the vaccine is that I feel that I do not want toxins put in my body. I have a very personal conviction that I should be able to judge personally what I put in my body and not have somebody else put my job on the line in jeopardy as a result of my personal beliefs. And God has given me my body to take care of. And the Bible says it's a temple, and I must take care of that temple. So that is number one. Number two, Title VII of the Federal Civil Rights Act gives us the right to keep our jobs and file a religious exemption. We should, by right, still be working at IU Health Goshen. They gave 11 employees exemptions, and 7 of us were rejected, and we were never given the reason why we were rejected, and they didn't. Unfortunately, the federal law does cover us, and we hired an attorney. He did a really nice job of producing the law and putting it in front of them. Unfortunately, they still refused our exemption request. So it's a justice issue, it's a religious issue, and it's a medical issue. It's kind of all intertwined in one, and it's all covered under Title VII. Okay,
thank you. Sue, the same question.
I really feel like God spoke to me. I'm a very quiet, prayerful woman, and I just feel like God was telling me it's okay. And I still feel like that. He told me it was okay to lose my job. It's going to be okay. My body doesn't need this. And he was really promoting me not to take it. And I took his stand. and I still do. I feel like that's what he's asking me to do, and someday I'm going to face his judgment, and I didn't want to be asked, why did you not listen to me? I try to listen with those holy nudges, as I call them. So that's my stand, and it's my deep conviction, and I still stand by that.
Okay, just to sum it up, what are your words on that?
I know that there are lots of healthcare workers out there who have lost their job or have really strong convictions against the flu vaccine. Again, I want to support you in that and ask that you would support us as well. It's a sad thing, and it's just wrong that we have lost our job. Some of the things that we have told you, just not right. It's just exactly not right.
Joyce?
And I would agree also. It's a real injustice as to what has happened to us, and we speak on behalf of Ann too. We all felt very strongly about our personal beliefs and biblically based beliefs, and we feel like it's pure discrimination. I just feel like to have 4 people on the flu exemption board at the hospital look at my beliefs and become judge and jury as to why they decided they were non-religious, when in fact it's a very religious stance. It's covered very broadly under the law. That the law says if they contain ultimate ideas about life, purpose, and death, then we are entitled to a religious exemption. We are firm believers in patient safety. We have done hand washing, and we have stayed home when we're sick. We practice all those things. Our patients have nothing to risk from us. We've been really good nurses, and unfortunately they're losing some really good nurses by terminating us.
I think we should put our faith in God and not in that flu shot. Mm-hmm. Know what your body needs and take care of it.
Thank you, Sue and Joyce, for this great information.